Hello everyone. Am I audible and visible? Let me know. Am I audible and visible? Let me check, then we'll start. Am I audible and visible? Let me confirm. Audible and visible? Let me confirm. Okay. Hello everyone. Welcome to Unacademy Future Doctors. I myself Dr. Dipti and I am your faculty for Physiology. Let me explain in brief about our subscription. We have two kinds of subscriptions, one that is plus subscription and second that is iconic subscription. Okay, now in plus subscription you can choose the best from the best. Here you can access both live as well as recorded classes. You can study on the device of your choice. You can learn from India's top educators for your medical exams. Here you can access question bank, which is having more than 25,000 questions. You can compete in the live test as well as quizzes. And with 12 months and above subscription, we also will provide you printed notes too. Now, second is our iconic subscription. Here, your access to the best from two of the best, and they are one is Unacademy and Prep Ladder with Unacademy. Here, the features I have already explained, and second one that is Unacademy and Prep Ladder with Prep Ladder. Here, the features are you can have clinical and integrated essentials. You can have video lectures from the Dream Team, Question Bank 3 with active guidance, system tags, and more. Rapid revision and snapshots and treasures in 2021 Dream Notes. We also have added certain features in our special class. We made the class interactive. You can attend the live classes and participate in the live chat. You can have a facility of raise a hand. You can poll for the learners too. You can never miss a class as you're always notified for your class, and you can get lecture notes. You can download lecture notes and get access to the recorded sessions. Also, you can attend live classes and participate in the live chat and get your doubts clear at any time. Also, we have updated and highly effective question bank, and this question bank contains 25,000 high yield clinical questions. These questions are based on latest exam pattern, and it also includes detailed explanations too. These are our NEET PG September 2021 toppers. Also, we have started Focus FMG 2022 comprehensive batch, and that is from 15 December, that is for 6 months, and Target NEET PG 2022 test and discussion batch from 15 December, and this is also for 3 months. Sorry, here. So you can subscribe either plus or iconic subscription. You can use my code Dipti10 and you can get 10% extra discount on each subscription. Okay. Now, another thing, you can participate in a live quiz. You can see live test. Here you have to go to app. You just select take a quiz option, and you can join the quiz using the code 491764. So this is the code for our quiz. Okay, now let us start with her today's topic. Just a minute, let me watch any chat history is there. Okay, fine. So now, yesterday we have discussed about the property that is first property, that is autorhythmicity. Okay, so sorry, just a minute. So our today's topic, that is the property, is our conductivity. So today we'll discuss about the property that is conductivity. Okay, let me start. Okay, so this is conductivity. Now, all of you are knowing some things you have been taught in your lower standards about this property, conductivity. Okay, so first of all we will discuss conducting system or conductive system of the heart. Okay, so this conductive system of the heart, it consists of specialized fibers. Okay, specialized muscle fibers of the heart muscle. So these are specialized fibers of heart muscle. Okay, and I think all of you are knowing which are these fibers. They are SA node, sino, atrial node. Here you can see this is SA node, AV node. This is your AV node. In between this SA and AV node, there are internodal pathway. You can see anterior, middle, and posterior internodal tracts. Then bundle, AV bundle. This is also known as bundle of his or AV bundle. Then two branches, right and left bundle branches. And lastly here these are Purkinje fibers. Okay, so these are the parts of conductive system of the heart. Okay, now sorry, starting with the SA node. Okay, this SA node, our SA node, you can see here it is located. So where is the location of SA node? That is located on the, you can write down simultaneously also, posterolateral wall. Posterolateral, you can see here posterior and laterally, posterolateral wall of the right atrium. You can see here this is the heart schematic diagram. This is right atrium, this side left atrium, this is right ventricle, this is left ventricle. Okay, so in the right atrium we have this SA node present on the posterolateral wall of the right atrium. You can see here that is present immediately below. You can see this is your superior vena cava. I think all these things in superficially you have learned in your lower standard. We will discuss all these things in detail in our medical studies. Okay, so you can see here this is superior vena cava. Okay, so at the near the opening of superior vena cava, just lateral, we have our SA node. This is the pacemaker of the heart. We will discuss in detail. Okay, this SA node, SA nodal fibers, they are connected directly with the atrial muscles also. So impulses once generated from the SA node, they will be conducted to the atrial fibers also. Okay, now what is the dimension of SA node? SA node is small, flat, shape is ellipsoidal shape, and that is the strip, the small strip of the muscle fibers, specialized muscle fibers. Okay, and length is, you just, if you can remember, this is good, maybe after the MCQ, length 15 millimeter, width about 3 millimeter, and thickness 1 millimeter. So this is these are the dimensions of SA node. Okay, and innervation, this is supplied by sympathetic and parasympathetic fiber because our heart rate is not under our control. So it is supplied by autonomic nerves. Autonomic nerve, they have two divisions, sympathetic and parasympathetic. Okay, parasympathetic, that is vagus nerve which supplies heart. Okay, so right vagus, because this is on the right side. Okay, so this is about your SA node. Now important thing comes, now the impulse once they are generated, this impulse is, you can see here from SA node, this is the pacemaker. Pacemaker means it generates impulse. Okay, impulse generation site, that is SA node. Okay, now this impulse is this spread in all the direction. First, so they spread to spread in three ways, 1, 2 and 3. Which are these three? Number one is because SA node is in the atrium, so this is spreading to the atrium. Okay, so first, so atrial muscles are depolarized with the electricity which is generated in the SA node. Okay, so cardiac muscles of the atria. Second, you can see here interatrial tract, here this one, through this track. I will show you in other diagram. I have it. You can see here this one, Bachmann's bundle. Interatrial means from one intercity we are telling है ना, हम लोग बोलते हैं ना इंटरसिटी. इंटर मीन्स दो को कनेक्ट करता है, तो interatrial bundle, interatrial. This is Bachmann's bundle. You can see here. So one is this impulses they pass through the atrium. Second, interatrial tract. So through interatrial tract, it will go to the left atrium. That is second. Third thing, it has got internodal tract. Internodal means between two nodes, these two, SA and AB node. So internodal tract we will discuss. There are three internodal tracts: anterior, middle and posterior. Okay. So internodal tracts. So these are the three directions in which these fibers generated from SA node they pass. Okay. Now, so what is the next is what is the structure of SA node? It is the pacemaker. So it is the cell, small, ill-defined outline. Okay. This consists of thin, elongated myofibrils, actin and myosin filaments. They have glycogen and mitochondria. Okay, in them. Shape is fusiform shape. Okay, and longitudinal striations are also there. And these cells are known as pacemaker cells or P cells because they are responsible for the generation of impulse, cardiac impulse. Okay, pacemaker activity. So why is it known as pacemaker? Because our whole heart contracts at a rate of SA nodal rate. SA node beats suppose at a rate of 70 to 80 beats. Our whole heart contracts at the rate of 70 to 80 beats per minute. Okay. Now, next is as I told you, interatrial tract. This is Bachmann's bundle. Okay. Interatrial means impulses from SA node they pass to other atrium, right to left side. And internodal conduction pathway. These are, you can see here, these three: anterior, middle and posterior. Okay, this internodal conduction pathway, these are modified atrial muscle fibers. Okay, this muscle fibers from the region of coronary sinus. Okay, this fibers, they are from the coronary sinus and they are in the fan like pattern. You can see here like fan. Okay, and they unite at AB node. You can see here. Okay, now so next is now these impulses are conducted from SA node to AB node through three bundles. You can see here. Okay, now as I told you, we remember names: anterior, middle and posterior. Anterior internodal tract is known as Bachmann's bundle. Okay, track of Bachmann, easy to remember. A and B, you can remember A, B. Anterior tract, Bachmann. Okay, it originates, you can see here, from anterior part of the SA node. It passes anterior to the superior vena cava here. Sorry, this one. This is interatrial. This one. This is also Bachmann's bundle, but this is interatrial. This is track of Bachmann. Okay, and then it descends and it ends in the AV node. Second is middle internodal tract. This is known as Vankebeck. Easy to remember. M को उल्टा कर दो, W हो जाएगा. Middle Vankebeck. I repeat, anterior AB. Anterior तो Bachmann, middle उल्टा करो Vankebeck. Okay. This is in the middle part. This one. Okay. And third, posterior PT. You can remember. PT periods हम बोलते थे ना, PT, तो you can remember in that way. Posterior, or also known as internodal tract of thoral tract. Okay, easy. Let us revise. Anterior Bachmann, AB. Middle M को उल्टा कर दो Vankebeck. Posterior thoral. Okay, these are three nodal tracts. Now, next is your AV node. Here it is located. This is also located in the right atrium. Posterior wall of the right atrium, same way here also. But just right side to the interatrial septum here. This is your interatrial septum. This basic things I am not going in detail because you have learned in your lower standard, between two atria, interatrial septum, between two ventricles, interventricular septum. Okay, so here you can see interatrial septum, just right side. Structure is same as SA node. Another thing here, this is located beneath the endocardium, near the opening of coronary sinus and tricuspid valve. You can see here, this is your tricuspid valve. Tricuspid valve, I think all of you are knowing, right atrioventricular valve. Right and left. Right atrioventricular is tricuspid, left is bicuspid or mitral valve. Okay, so this two. Next is innervation, nerve supply, again same thing, vagus nerve and sympathetic nerve. Okay, vagus here, left vagus supplies, right vagus supplies, because SA node derived from right side in the embryological life, so this is having right vagus nerve. Here this is supplied by left vagus nerve. Okay, and when we stimulation by excitation, when impulses they come from SA node through this tracts, internodal tracts to the AV node, then it gets stimulated. Okay, and from AV node impulses they pass through AV bundle to the ventricles. Okay, now very important thing, there is only one pathway for the impulse to get transmitted from SA node to AV node, and from atria to ventricle, and that is AV node. Okay, now next part is bundle of His. You can see here this one, bundle of His. In this diagram you can easily see. So this bundle of His, it originates from AV node. Okay, and it runs upward, you can see slightly upwards, to the posterior margin of the interventricular septum. Okay, and then forward, then below, and then it is immediately after that it will be divided into right and left bundle branches. Okay, now this you can see left bundle branch, it pierces the membrane and it lies on the upper border of the muscle septum, and then it is divided into anterior and posterior fasciculus. Okay, and right bundle branch towards right side, you can see here. Okay, and this branches ultimately they break up in Purkinje fibers. This. Okay, now next is Purkinje fibers. They originate from the terminal divisions of right and left bundle branches. Okay, bundle of His. Okay, very important thing here, this Purkinje fibers, they are large, they are thick fibers. Then SA node, the length is about 10 to 40. This values you have to remember for your MCQs. 10 to 46 micrometer, and their diameter is 70 to 80 micrometer. Very important thing, they have large number of gap junctions. Okay, and these gap junctions have high permeability, and because of this, velocity of transmission of Purkinje fiber is highest. This is 1.5 to 4 meters per second. This is the permeability. This velocity is 6 times the velocity of ventricular muscle and 150 times than that of the velocity of AV nodal fibers. Okay, now we'll discuss the conduction velocity of different cardiac tissue. SA node, try to remember these values. It is 0.05 meter per second. Atrial pathway 1 meter per second. AV node 0.05 meter per second. Bundle of His 1 meter per second. Purkinje fibers highest 4 meter per second. Ventricular muscle 0.3 to 0.5 meter per second. Atrial muscles 1 meter per second. Okay. Next is, now how the impulses they spread. As I told you, they are generated from the SA node. From SA node to the atrium, they are transmitted. From SA node to the other atrium, transmitted by Beckman's bundle. Okay, then just a minute, let me. Then what happens next is just a minute, somebody. Sorry, there is some message. I just have to. It is not visible. Let me just. Let me just refresh it. It is not visible. Okay, fine. Now, so here, this is from Bachmann's bundle. It is transmitted from one atrium to the other atrium. Okay. Now, next is impulses from SA node to the AV node, that is by interatrial branches. Okay, interatrial bundles. Okay. Another thing. Now, next is very important thing here is AV nodal delay. What is this AV nodal delay? When impulses they come at AV node, what happens? There is some time which is required for the impulse to pass through AV node, and this is 0.09 second. This is known as AV nodal delay. Okay, plus this is 0.09 second is the time interval for AV node. Then after AV node we have AV bundle. AV bundle again it requires 0.04 seconds. Okay, so total delay is 0.13 seconds at AV node. Okay, try to remember this value. Now, what is the cause for the delay? Why at the AV node there is a delay? Because these fibers are small fibers, transitional small fibers connecting, or that is AV nodal fiber. Okay, second, their gap junctions are less. They have less gap junctions. Okay, and another thing is these fibers, they have long refractory period, and therefore impulse conduction is slow. Okay, now next is, what is the advantage? This is again AV node. So you can see here small fibers, few gap junctions, few sodium channels, so long refractory period. Then this delay, AV nodal delay, is reduced by sympathetic. So when AV nodal delay is reduced, then what happens? Heart rate increases, and this AV nodal delay is increased by parasympathetic fibers. When it is increased, then heart rate decreases. Delay, if increases, rate decreases. Delay decreases, rate increases. Okay. Now, what is the importance of AV nodal delay? Why this delay is there? Because AV node, it has ability to decrease or block the conduction. This from SA node to AV node impulses, or you can say from atria to ventricles impulses, they pass only through your AV node. Okay, here. So AV node has ability to decrease or block the impulse conduction. Okay, so what is the advantage? Because of this block, atria completes its contraction before ventricle starts its contraction. Okay, so this is one advantage. Okay, so AV node connects atria to the ventricle. It is the only pathway through which impulses are transmitted from atria to the ventricle. Okay, so you can see here this, because of this delay, atrial contraction gets completed. Okay, now next is AV block. What is it? AV block means here there is complete blockage of impulse transmission. If impulses are not transmitted from SA node through AV node, so this is known as AV block. So what happens if there is AV block? Impulses are not conducted. Then what happens? New impulse generation starts after AV node. Okay, so then what happens? Your bundle of His starts generating impulses. Then if it is blocked, then bundle branches, then Purkinje fibers. Okay, so this is the applied aspect. Okay, now how the impulses are conducted, that we have to learn is, you can see here, first impulse they get initiated from SA node, then to the AV node, bundle branches. Okay, then from bundle branches, you can see here, from AV node, bundle of his bundle branches. Then first part of the ventricle to be excited, that is interventricular septum, except the basal part, because here this impulses they pass like this, lastly to the basal part, like this, here this way. Okay, and papillary muscles. Another important thing, depolarization is more towards right side first. Okay, and it spreads down to the septum towards the apex here. Okay, then you can see here, this way impulses are transmitted like this. Okay, you can see this way. And last part of the heart to be depolarized, that they are posterior basal portion of left ventricle, pulmonary conus, and uppermost part of interventricular septum here, interventricular septum. Okay, so just a minute. Then now, how much time is taken for the impulse to travel through different tissues? And that is, you can see from SA node, time required, that is 0.03 seconds. AV node, impulse require 0.13 seconds. Then bundle branches, this too, 0.03 seconds. Purkinje fibers take 0.03 seconds. And last, to endocardial and epicardial surface of the ventricle, they get depolarized like this way. Okay, total time required, that is 0.22 seconds for the impulse generated from SA node to depolarize the whole heart. Okay, parasympathetic, when it is stimulated, vagus nerve, what happens, impulse generation decreases. Okay, and sometimes if it is continuously stimulated, that results in the blockage or stoppage of the impulse to pass, and that is known as ventricle. And ventricle, they start their own rhythm, because vagus now supplies only atrium. Okay? Ventricles are not supplied by the vagus nerve, so there is ventricular escape because of the vagal stimulation. Okay, when the vagus nerve is stimulated strongly, you can see heart stops beating for few seconds. Okay, this is known as vagal effect. Okay, because of the strong vagal stimulation. Okay, but after sometimes there is vagal escape, means heart starts beating because of the ventricular action. Now, another applied aspect, that is Stock-Adams syndrome. What is Stock-Adams syndrome here? Just a minute. So here you can see, when ventricles, they stop beating. Here in Stock-Adams syndrome, what happens? I'll just show you that when ventricles, they stop beating for 5 to 20 seconds. Okay, here during this 5 to 20 seconds, ventricles, they fail to pump because ventricles are not beating. So the patient feels fainting for this 5 to 20 seconds because of decrease in the blood flow to the brain. Okay, the person is feeling fainting attack, and that is known as Stock-Adams syndrome. Okay, because of the effect of the continuous vagus stimulation. Okay, so this is Stock-Adams syndrome. Next applied aspect, that is Wolff-Parkinson's-White syndrome. What is this? Normally, as we have discussed, as impulses require AV node for transmission from atria to the ventricle. So this is the normal pathway, but sometimes there is one abnormal pathway. This is bypass tract. This is known as bundle of Kent. When this bundle is present, what happens? Impulses are transmitted from atria to the ventricle directly. Here you can see. Okay, and here most of the time symptoms are not present, but sometimes the person is having fast rhythm because impulses are passing fast, and there is re-entry. Instead of going through this pathway, impulses they pass through opposite direction. Okay, and treatment for this is radio frequency catheter ablation. By inserting catheter with the help of radio frequency, this bundle is ablated, that is blocked. Ablation, that is the treatment for this Wolff Parkinson's White syndrome. Okay, so this is all about today's class. Thank you. If you like my video, you can like it, you can share with all your friends, and you can subscribe our channel Unacademy Future Doctors. After this at 10:35 p.m. I have my open house session. Okay, so I have my open house session. We will do discussion regarding question answers, okay, of this topic. So you can join the session, you can open the app, and you can join the session of open house regarding this topic question.